Prime Minister.
Thank you, Mr. Speaker. With permission, I'll make a statement about the next steps in our battle against coronavirus and how we can, with the utmost caution, gradually begin to rebuild our economy and reopen our society. For the last 2 months, the British people have faced a grave threat with common sense, compassion and unflinching resolve. We have together observed the toughest restrictions on our freedoms in memory, changing our way of life on a scale unimaginable only months ago. All our efforts have been directed towards protecting our NHS and saving lives. Tragically, many families have lost loved ones before their time, and we share their grief. Yet our shared effort has averted a still worse catastrophe, one that could have overwhelmed the NHS and claimed 500,000 lives. Every day, dedicated doctors, nurses and social care workers, army medics and more have risked their own lives in the service of others. And they have helped to cut the reproduction rate from between 2.6 and 2.8 in April to between 0.5 and 0.9 today. The number of COVID patients in hospital has fallen by over a third since Easter Sunday. Our armed forces joined the NHS to build new hospitals on timetables that were telescoped from years to weeks, almost doubling the number of critical care beds and ensuring that since the end of March, at least a third have always been available. Our challenge now is to find a way forward that preserves our hard-won gains while easing the burden of the lockdown. And I will be candid with the House, this is a supremely difficult balance to strike. There could be no greater mistake than to jeopardise everything we've striven to achieve by proceeding too far and too fast. We will be driven not by hope or economic revival as an end in itself, but by data and science and public health. And so the government is today submitting to the House a plan which is conditional and dependent, as always, on the common sense and observance of the British people and on continual reassessment of the data. That picture varies across the regions and home nations of the United Kingdom, requiring a flexible response. Different parts of the UK may need to stay in full lockdown longer, but any divergence should only be short-term, because as Prime Minister of the UK, I am in no doubt that we must defeat this threat and face the challenge of recovery together. Our progress will depend on meeting 5 essential tests: protecting the NHS, reducing both the daily death toll and the infection rate in a sustained way, ensuring that testing and PPE can meet future demand, which is a global problem, but one that we must fix, and avoiding a second peak that would overwhelm the NHS. A new UK-wide joint biosecurity centre will measure our progress with a 5-stage COVID alert system, and the combined effect of our measures so far has been to prevent us from reaching level 5, a situation that would have been in which the NHS would have been overwhelmed, and to hold us at level 4. Thanks to the hard work and sacrifices of the British people, by following the social distancing rules, we're now in a position where we can move in stages to where I hope the scientific advice will tell us that we are down to level 3. But this will only happen if everyone continues to play their part, to stay alert and to follow the rules. We must also deal with the epidemic in care homes, where a tragic number of the elderly and vulnerable have been lost. And while the situation is thankfully improving, there is a vast amount more to be done. And of course, we need a world-leading system for testing and tracking and tracing victims and their contacts. So I'm delighted that Baroness Harding, the chair of NHS Improvement, has agreed to take charge of a programme that will ultimately enable us to test hundreds of thousands of people every day. All this means that we have begun our descent from the peak of the epidemic, but our journey has reached the most perilous moment where a wrong move could be disastrous. So at this stage, we can go no further than to announce the first careful modification of our measures. Step 1 in moving towards COVID alert level 3, a shift in emphasis that we can begin this week. Anyone who cannot work from home should be actively actively encouraged to go to work, and sectors that are allowed to be open should indeed be open, but subject to social distancing. These include food production, construction, manufacturing, logistics, distribution, scientific research. And to support this, to explain this again, we're publishing guidance for businesses on how to make these workplaces safe, COVID secure. People who are able to work from home, as we've continually said, should do so. People who cannot work from home should talk to their employers about returning this week and the difficulties that they may or may not have. Anyone with COVID symptoms, obviously, or in a household where someone else has symptoms, should self-isolate. We want everyone travelling to work to be safe, so people should continue to avoid public transport wherever possible, because we must maintain social distancing, which will inevitably limit capacity. Instead, people should drive, or better still, walk or cycle. With more activity outside our homes, we would now advise people to wear a cloth face covering in enclosed spaces where social distancing is not always possible, and you're more likely to come in contact with people you don't normally meet. The reason is face coverings can help to protect each other and reduce the spread of the disease, particularly if you have coronavirus-like symptoms. But this does not mean, I must stress this does not mean wearing medical face masks, 2R or FFP3, which must be reserved for people who need them. We have all lived so far with onerous restrictions, Mr. Speaker, on outdoor spaces and exercise. And this is where my right honourable friend interjects from the Secretary, because I know he's a keen swimmer, Mr. Speaker, and unfortunately we can't do anything for swimming pools, but we can do something for lakes and the sea. This is where we can go significantly further, and because there is a lower risk outdoors than indoors. So from Wednesday, there will be no limits on the frequency of outdoor exercise people can take. You can now walk, sit and rest in parks. You can play sports and exercise, and you can do all these things with members of your household, your own household, or with one other person from another household, provided you observe social distancing and remain 2 metres apart. And I do hope that's clear, Mr. Speaker, and I'm conscious people want to come back and ask questions in more detail, and I'll be very happy to answer. We shall increase the fines for the small minority who break the rules, starting at £100 but doubling with each infringement up to £3,600. You can drive as far as you like to reach an outdoor space subject to the same rules and the laws and guidance of the devolved administrations. I'm sorry to say, however, Mr. Speaker, that we shall continue to ask those who are clinically vulnerable, including pregnant women and people over 70, or those with pre-existing chronic conditions, to take particular care to minimise contact with those outside their households. And we must continue to shield people who are extremely vulnerable. They should, I'm afraid, remain at home and avoid any direct contact with others. I know that easing restrictions for the many will only increase the anguish of those who must remain shielded. So the government will look at every possible way of supporting the most vulnerable. Mr. Speaker, all of our precautions will count for little if our country is reinfected from overseas, so I give notice that we shall introduce new restrictions at the UK border, requiring 14 days of self-isolation for international arrivals, while respecting our common travel area with Ireland. Every day, we shall monitor our progress, and if we stay on the downward slope and the R remains below 1, then, and only then, will it become safe to go further and move to the second step. This will not happen until the 1st of June at the earliest, But we may then be in a position to start the phased reopening of shops, to return children to early years settings, including nurseries and childminders, to return primary schools to school in stages, giving priority to the youngest children in reception and year one, and those in year 6 preparing for secondary school, and to enable secondary school pupils facing exams next year to get at least some time with their teachers. Our ambition, and I stress this is conditional, Mr. Speaker, is for all primary school pupils to return to the classroom for a month before the summer break. To those ends, we are publishing guidance on how schools might reopen safely. Step 2 could also include allowing cultural and sporting events behind closed doors for broadcasts, which I think would provide a much-needed boost to national morale. But nothing can substitute, Mr. Speaker, for human contact, and so the government has asked SAGE when and how we could safely allow people to expand their household group to include one other household on a strictly reciprocal basis. Finally, no earlier than July, and Mr. Speaker, I'm conscious that you wanted me to wind up, but I may say...
I did say 10 minutes, and you've gone over it quickly.
I understand that. Well, perhaps, Mr. Speaker, would it be in order if I requested that my interrogation could continue for a little bit longer in order for me to make all these points? No earlier than July, we may be able to move to step 3 if and only if supported by the data and the best scientific advice. We would then aim to reopen some remaining businesses, including potentially hospitality, cinemas and hairdressers, as well as places of worship and leisure facilities. And this will depend on maintaining social distancing and new ways of providing services. So we will phase and pilot any reopenings to ensure public safety. And I must be clear again, if the data goes the wrong way, if the alert level begins to rise, we will have no hesitation in putting on the brakes, delaying or reintroducing measures locally, regionally or nationally. Mr. Speaker, our struggle against this virus has placed our country under the kind of strain that will be remembered for generations. But so too has the response of the British people. So too will the response of the British people, from dedicated shop workers keeping our supermarkets open and ingenious teachers finding new ways of inspiring their pupils, to the kindness of millions who have checked on their neighbours, delivered food for the elderly or raised astonishing amounts for charity. In these and in so many other ways, we are seeing the indomitable spirit of Britain. And Mr. Speaker, let me summarise by saying that people should stay alert, by working from home if you possibly can, by limiting contact with others, by keeping your distance to 2 metres apart where possible, washing your hands regularly, and if you or anyone in your household has symptoms, you all need to self-isolate. Because if everyone stays alert and follows the rules, we can control the virus, keep the rate of infection down, and keep the number of infections down. And that is how we will be able, Mr. Speaker, to save lives and to save livelihoods as we begin to recover from the coronavirus, and I commend this statement to the House.
What I'd like to say is to the Leader of the Opposition, please take an extra minute after that. Thank you. Leader of the Opposition, Keir Starmer, 6 minutes.
Thank you, Mr. Speaker. Can I thank the Prime Minister for advance copy of his statement and for advance copy of the command paper that his office sent through an hour or so ago, and for taking time to speak to me and other opposition leaders yesterday before his speech. And can I start by acknowledging just how difficult the decisions are that now fall to be taken? We do recognise how difficult they are. What the country needs at this time is clarity and reassurance. And at the moment, both are in pretty short supply. And at the heart of the problem, it seems, is that the Prime Minister made a statement last night before the plan was written, or at least finalised. And that has caused considerable confusion. So yesterday afternoon, there was a number 10 press release that said, from Monday, i.e. today, anyone who can't work from home, for instance, those in construction and manufacturing, should be actively encouraged to go to work. So it's understood from that it was today was the start day, and that was for construction and manufacturing. A few hours later, the Prime Minister made his statement. There was no express reference to time frame. Today, in the command document, page 25, it says that these policy changes apply from Wednesday, and the list has been expanded from construction and manufacturing to other sectors. So now we have a start date of Wednesday and a wider range of sectors that are going back to work on Wednesday. So far, so good. One of the key issues then is, will there be guidelines in place to ensure safety at the workforce? They were being consulted on last Sunday. They were vague and had big gaps in. So under protective equipment, it just said to be inserted or to be added. In the document I've now seen, it says that workplaces should follow the COVID secure guidelines, which I assume are the same guidelines, as soon as practicable. But under page 22, it says they will be released later this week. So we know some people are going back to work on Wednesday. The guidelines have not been published. They're apparently going to be released later this week. So can I just ask the Prime Minister, will the guidelines, the safety guidelines, be ready for Wednesday, which realistically means tomorrow, if workplaces are going to be ready for them for Wednesday morning? If not, is he seriously asking people to go back to work without the guidelines? Have the guidelines now been agreed with businesses and trade unions? That was the attempt that was going on Sunday a week ago. And do the guidelines only apply in England? Can I then turn to getting to work, because this has been the other issue of some concern. The Prime Minister said last night that people shouldn't rely on public transport. The command paper now, page 26, says the government is working with transport providers to bring services back to pre-COVID-19 levels as soon as possible. So bring the services back to their old levels, and says social distancing guidelines on public transport must then be rigorously followed. So ramp up the service, new guidelines for social distancing. But again, we learned from page 26, unfortunately, those guidelines not ready. And they're coming later in the week. Well, are they coming tomorrow, ready for Wednesday, or later in the week? Because otherwise people will be using public transport, operators required to operate to guidelines that don't yet exist. And again, is that for England only? And have those guidelines been agreed with the transport providers and the relevant trade unions? Mr. Speaker, one other point about work. There is a real concern that the Prime Minister might be able to clarify for those that have got childcare responsibilities, with schools not going back till June, and I understand the conditionality behind that. Should they go back to work on Wednesday or not, because they're in a quandary as to what to do? Can I then turn to international travel? Last night the Prime Minister said in his speech that he was proposing to impose quarantine on people coming into the country by air. Well, given that 100,000 people have arrived in the UK since the start of lockdown, why is that only being introduced now? And is it only for those arriving by air? Because the command paper now says it's for all international arrivals. So does that mean all ports? And again, is that England or the UK? But it then goes on to say these international travel measures, i.e. the quarantine, will not come into force on Wednesday, unlike the other policy changes, but will be introduced as soon as possible. So when's that going to be? The Prime Minister also said we're going to be driven by the science, the data and public health. So what is the scientific evidence and the public health basis behind the measures announced and the stay alert message? And finally, the Prime Minister will know that there's not consensus either on messaging now or on policy between the UK government and those in Wales, Scotland and Northern Ireland. Not something I know he wanted to see, but now we're in that position. Raises serious concerns with a real danger of divergence. And again, this is clear from the document that he provided to me an hour or so ago. Page 27 says, travel to outdoor spaces is now permitted irrespective of distance, but we must respect the different rules in Scotland, Wales and Northern Ireland. Does that mean one can travel to the border but not presumably beyond the border where there are differences, which makes enforcement extremely difficult and clarity really difficult? So what can we do, what can he do to ensure that we exit lockdown as one united kingdom just as we entered it? Mr. Speaker, there are lots of questions, but so far precious few answers. The country does need clarity on this, and people need reassurance above all else. They need it in the next 48 hours. So can the Prime Minister now please provide that clarity?
Prime Minister.
Thank you very much, Mr. Speaker, and I'm grateful for all the questions that the right honourable gentleman has raised and the spirit in which he's raised them. And let's be absolutely clear, what we're trying to do now, I think he was good enough to refer to himself. We're moving from a situation in which the people of this country have had the overwhelming impression that there's a very clear and simple piece of advice, Mr. Speaker, that we all have to obey, which is, broadly speaking, stay at home. And the people of this country have, by and large, followed that advice in perhaps more emphatically, more thoroughly than many other populations around the world. But thanks to their efforts, what's happened is that we've got the disease, we've made huge progress, Mr. Speaker, in fighting the disease, we've got the R down, and we need now to begin, as it were, to acknowledge the progress that has been made and to take the small, limited steps that we can with the R down where it is. And that's what the government is trying to do. And clearly, when you're coming out of a message that is so gloriously simple as stay at home, there will inevitably be complexities that he's rightly alluded to. Let me try and deal with some of the issues that he raised. What we're saying now is that you should stay at home if you can, but go to work if you must, if your job doesn't allow you to go to work. And plainly, he raised properly the issue of people who don't have the right childcare, Mr. Speaker, and we will count on employers to be reasonable. If people can't go to work because they can't get the childcare that they need, then plainly they are impeded from going to work, and they must be defended and protected on that basis. If their kids can't yet go to school because the schools aren't back, then plainly they can't go to work. And I think people with common sense, businesses, employers with common sense, do understand that. I think it's incumbent on all of us to get that message across. But I think one thing that was perhaps missing from his analysis, Mr. Speaker, was the simple fact that over the last couple of months, actually plenty of businesses, from construction to manufacturing, office businesses of all kinds, actually have been proceeding, and they have been working. They've been doing so in a way that respects social distancing, that is as COVID compliant as possible. And so, to answer his specific questions about the timescale for the publications of our guidelines, we will be publishing the guidelines on places of employment today, tonight. Transport will be out tomorrow, and we're being very, very consistent in what we've said throughout this period. At the very beginning, we said that you should stay at home if you can, go to work if you must. What's changed now is the emphasis and the encouragement that we're giving to people, as it were, to follow the initial guidance of March the 23rd, I think it was. He asks, Mr. Speaker, about what science it's going to be based on, and how we've reached the conclusions that we have. As I said last night, as I told the House, the reproduction rate of the disease is now between 0.5 and 0.9. It varies across the country, as he rightly says, and that's why actually different approaches by the devolved administrations are to be welcomed where those are appropriate to their specific needs. But overall, and I think that all leaders of the devolved administrations would confirm this, there is a very, very strong desire to move forward as 4 nations together. And perhaps I can sum up, and we all share the strong view that you should stay at home if you can. That remains the position. So the steps we're taking today are modest steps, entirely governed by the science. We hope that we may be in a position, and this is entirely conditional, to take further steps in. Forgive me, Mr. Speaker. Further steps in the next few weeks. He asks given the complexity of what's being said, and he raises a perfectly reasonable point about people moving across the border into Wales for recreational purposes, or I totally understand, and believe me, there will be myriad other hypothetical situations which people will be able to raise. But let's be absolutely clear, Mr. Speaker, that I think everybody understands what we are trying to do together. And that is that is working together as a country to obey the social distancing rules, which everybody understands. And I think what the British people understand, that this is the moment for the whole country to come together and to obey those rules and to apply their common sense in the application of those rules. And I have huge admiration for the way that the police have enforced them so far, and I know that the British public is going to continue to help the police and everybody to enforce those rules, to get our reproduction rate down, to get this disease even further under control by continuing to apply good, solid British common sense. It's worked throughout phase 1, and I've no doubt that it's going to work in the second phase of the disease as well, of the fight against the disease as well.